It's late winter here in the UK and I'm surrounded by ferrets which are coming into season. So in this video we'll look at what the signs are of ferrets coming into season, why you need to act, and what neutering options are available to you to safely bring your ferrets out of season. So let's jump in. Ferrets have a photoperiodic reproductive system. This means that the period in which they are capable of reproduction is dependent on the amount of daylight they receive in any one day. Ferrets evolved in the Northern Hemisphere in Europe, where the length of daylight hours swings dramatically from winter through to summer. After midwinter, when the days start getting longer, this triggers hormones within the ferret's body to make physiological and behavioural changes, which brings on the breeding season. Then, in late summer, as the days start getting shorter, the hormones fall away and the ferret starts to come out of season. For females, being in season is referred to as Oestrus, and for males, it is referred to as being in rut. Males and females react very differently to being in season, so let's look at each of these in turn. When a male is out of rut, his testes are not visible as they reside within the body. Then as the male comes into rut, these testes will descend and be visible externally. The hormones will also trigger a significant increase in the production of oils and musks from pores and glands throughout the ferret's body. This will make him much oilier and much stinkier. In fact, albino ferrets have been known to go from bright white out of rut to almost Fanta orange when in rut due to the oils. He will also start to mark his territory by weeing and dragging his lower body through this in order to spread it throughout his environment. Lovely, hey? He will become obsessed with finding a mate and therefore become less docile and more hyperactive. It will make him more aggressive to other males and will constantly pester females and attempt to mate regardless of whether they are in estrus or not. For this reason, it is usual for breeders to move unneutered males into isolation for the duration of the breeding season. For females, there is a very clear visible sign in that her vulva will swell up considerably to around the size of her chickpea. She will also create more oils and musk on her skin and fur, but this will not be anywhere near as bad as with the males. In terms of behavioural changes, she will become more maternal, often excessive grooming and dragging around of her cage mates, treating them as they were kids. Before we explain what the neutering options are for a ferret, we might first consider why bother? Why don't we leave them alone, and why do we interfere? Ordinarily, I don't condone messing around with animals' bodies just to make them more amenable to human wishes, but for ferrets in season, there are some valid justifications. A female will come into estrus when the days start getting longer, this being late winter in European climate, and will remain so until the days start getting shorter at the end of the summer. That is, of course, unless she is mated or unless there is human intervention. Remaining in estrus for such a long time is a serious problem for females and can result in significant health problems and even death. The reason being that when a female is in estrus, her estrogen levels go through the roof. Increased estrogen suppresses bone marrow activity. Bone marrow is responsible for the production of red and white blood cells and platelets. Low red blood cell count leads to anemia and causes a critical lack of oxygen to the organs. Low white blood cell count leaves the ferret less able to fight infections. And low platelet count leaves the ferret exposed to hemorrhages. Finally, the swollen vulva itself increases the risk of contracting infection. Internal hemorrhage is the primary cause of fatality in unneutered females left in season. The impact on bone marrow function develops over time, however, and isn't simply an on-off condition. Therefore, there's plenty of time, once you notice the ferret is in estrus, to book and attend the vet appointment. Veterinary publications indicate that issues don't tend to arise until after the first month of estrus. When it comes to males in rut, there isn't the same urgency or health concern as there is in females. A male will remain physically healthy in rut throughout the breeding season. The issue, however, is more one of psychological well-being in males. A male in rut will be constantly obsessed with finding a mate and will be very restless. He'll also need to be isolated from any friends he had previously. If he is not going to be used as a stud for breeding, it may be kinder to have him neutered so that he can return to a more peaceful state of mind and be returned to living with his friendship group. There are both surgical and medical options for neutering ferrets. Often the word neutering refers to a surgical procedure, but for simplicity here in this video, we've just used it generically to refer to any sort of process for taking a ferret out of season. The traditional approach is to surgically neuter the animal. For males, this will be castration, which is the complete removal of the testes, And for females, it will be the removal of the ovaries and uterus, referred to as a spay. Surgery is, of course, permanent, irreversible, and 100% effective. Costs often vary from clinic to clinic, but the procedure is routine and quick, and so the cost is relatively reasonable at around £100 to £200. Recovery from this surgery is rapid and uneventful. However, the downside is that there is a risk of complications in the surgery or as a result of the anaesthetic, and unfortunately, deaths do occur during this procedure. Finally, whilst the surgical procedure renders the ferret infertile and prevents them coming into season, there remains a hormonal element to the reproductive system, and this can put the ferret at risk of adrenal disease. It goes a bit like this. When the ferret is surgically neutered, it no longer produces sex hormones from the ovaries or testes. These sex hormones were needed to regulate the production of other hormones in the brain. This brain hormone is now produced in excess volumes, and hence it continuously stimulates the adrenal gland. With time, this extra strain causes cell damage and mutation, and hence tumours start to grow in the adrenal glands. Now, whilst this is not a definitive proven causation, it is referred to in veterinary publications as a risk factor. Check out the link above for a more detailed video on adrenal disease in ferrets. For decades, there had been an injection, known by owners as the Jill jab, which would take female ferrets out of Oestrus. This was very effective and would usually last the whole season, although on occasion it may need a repeated dose. This injection was a drug which went under the brand name delvosterone, and the active ingredient was the hormone prologestone. The Jill jab could often be obtained in group clinics from as little as £10 a shot, although typically a vet would include a checkup, so the cost would be more in the region of £60. The Jill jab was safe and relatively risk-free, although it only worked on females. There was no similar jab for males. Unfortunately, in 2023, the manufacturer decided to cease production of this drug, and at time of this video, no other manufacturer had taken up the mantle. There is another option, which goes under the brand name Receptal, which uses the drug buserelin, which is similar to the delvosterone Jill jab, but has a much shorter effective period of only around a month or two. This drug has typically been uncommon in the ferret community, but is starting to be looked at more due to the cessation of the delvosterone Jill jab. An alternative to the Jill jab is that of a hormone implant. This implant is manufactured under the brand name Suprelorin, and the active ingredient is deslorelin acetate. This is a slow-release implant placed under the skin, and the drug is released slowly over a period of around 2 to 3 years. Unlike the Jill jab, the implant does, however, work on both males and females. Due to its longer-lasting effects, it is more expensive than the Jill jab or surgery, and you'd expect to pay around £150 to £250 per ferret. Given the need to repeat this implant every 3 years, this could become quite a significant price disadvantage over a surgical procedure. By giving a male ferret a vasectomy, this means that he could be used to mate with a female ferret and bring her out of Oestrus without making her pregnant. This is a relatively short-term fix, as the female will just come back into Oestrus again a few times over the season, but many ferret owners do have a vasectomized male in their group to perform this service for the Jills. As one vasectomized male ferret can service a number of unneutered females, this is a very cost-effective and natural way to manage the risk of Oestrus in female ferrets. Unfortunately though, whilst the vasectomy will make the male ferret infertile, it will have absolutely no impact on the symptoms of being in rut. So he will continue to act, behave, and smell in just the same way as an unneutered male. Rather confusingly, therefore, a vasectomy is a neutering option for a female rather than a male. As you've probably gathered, there's no one unique single best solution for neutering ferrets. Ferret owners will develop their own preferences depending on their own unique circumstances. We just hope this video provides you with more understanding of the reasons and possibilities. Please do like and subscribe for more ferret content, and why not try out the Ferret Breeder series, the first part of which is on the screen right now, which will run through what happens if you don't choose a neutering option.